Chapter 1: Introduction to ER Diagrams. Ever wondered how data is organized in a database? How do all the different pieces of information connect with each other? Well, the answer lies in something called an entity relationship diagram, or ER diagram for short. ER diagrams are like blueprints for databases, showing how different entities relate to each other in a logical and structured manner. Chapter 2: Designing an ER diagram for a dental clinic management system. Consider the scenario of designing an ER diagram for a dental clinic management system. This system needs to efficiently manage patient appointments, treatments, and staff. So, where to start? First, identify the entities. Entities are the main objects or concepts that the system needs to keep track of. For a dental clinic, these would be the patient, the doctor, the appointment, and the treatment. Each entity represents a type of object in the real world that is distinct and independent. Next, define the attributes of each entity. Attributes are the specific pieces of information that describe each entity. For example, a patient has attributes like patient ID, name, and contact details. A doctor has attributes like doctor ID, name, and specialty. An appointment has attributes like appointment ID, date and time, and the IDs of the patient and doctor involved. And a treatment has attributes like treatment ID, description, and cost. Chapter 3: Defining relationships in the ER diagram. Now, it's time to define the relationships between these entities. Relationships show how the entities interact with each other. In this scenario, a patient can have multiple appointments with different doctors, and a doctor can treat multiple patients. Each appointment involves one or more treatments, and each treatment is associated with a specific appointment. Chapter 4: Visual representation of the ER diagram. Once all the entities, attributes, and relationships are defined, they can be visually represented in an ER diagram. This diagram shows how patients, doctors, appointments, and treatments are connected. For instance, a patient, identified by a unique ID, schedules an appointment with a specific doctor. During that appointment, one or more treatments are performed. Chapter 5: Summary of ER diagrams. To summarize, an ER diagram helps to organize data in a database by identifying the entities, defining their attributes, and establishing the relationships between them. In this example, the entities were patients, doctors, appointments, and treatments. Each entity had specific attributes, and relationships were defined between patients and doctors, and between appointments and treatments. Remember, this is a simplified example. In real-world scenarios, ER diagrams can become much more complex, involving additional entities, attributes, and relationships. But hopefully, this gives you a clearer idea of how ER diagrams help to structure and organize data in a database. So, the next time you're dealing with a database, remember to thank the humble ER diagram for making sense of all that data.